We would request you to kindly accept a memento from our chairman, Dr. V. Mohan.
Thank you, sir.
University Hospital for the past 20 years. Dr. Cho holds a doctorate in chronic disease control law and preventive medicine at Adju University Medical School, such as the Royal Order of Samarati, Grand Cross, I hope that I said that right, and the Royal Order of Monisasa and Social Works. Sir, thank you very much for joining us today, and we request you to kindly accept a memento from Dr. Ranjit Unikrishnan, Vice Chairman. World Health Organization, Geneva, Switzerland. Professor Bull is a professor at School of Earth and Environment and Society for Physical Activity and the past chair of the Global Advocacy for Physical Activity and independent academic positions with extensive experience in leadership of national and international research collaborations, which has resulted from Dr. Guha Pradeepa, Senior Scientist and Head Research Operations at MDRF. His MBBS from Maulana Azad Medical College, New Delhi, and MS Ophthalmology from Lake National Health for the past 15 years. He has set up a center for advanced research on environmental health, air pollution, MLN Medical College, Allahabad. She is an MD in Pediatrics and a DM in Endocrinology from the All India Institute of Medical Sciences, New Delhi. And as a token of our appreciation, kindly accept a memento from Mrs. Parvati, Associate Vice President.
Thank you.
We moved, that was on 1st September 1991, patients at a reasonable cost. Over the years, as we speak, we currently run 33 branches of our center, 16 of which are in Tamil Nadu, 1 in Puducherry, 6 in Karnataka, 2 in Kerala, 4 in Telangana, 1 in Andhra Pradesh, 1 in Odisha, 1 in Delhi, and 1 in Uttar Pradesh. And this has been only possible because of all our students who have qualified and decided to work with us, and also the excellent team that we have at Dr. Mohan's. We have currently 1,159 full-time staff who work with us, 58 consultants, and over 400,000 patients. And the aim is to reach 1 million patients in the next 3 to 4 years. You might ask what makes you special or what makes us special. I don't think anything is special except that we put it all together. So we have outpatient services, inpatient services, eye, foot, dental, heart, radiology, education, physical activity, yoga, pharmacy, operation theatre. The whole thing, when you put it under one roof, then it becomes something special, and that's what we call as total diabetes care. Moving on to the Madras Diabetes Research Foundation. This is a 100% non-profit organization. Again, it started with one room, with one staff in the year 1996. Today we have 5 facilities: the Clinical Research Unit at Gopalapuram, the Basic Science Research Institute at Siruseri, which is a 6.5-acre campus with 40,000 square feet facility. We have an Epidemiology, Prevention and GDM Research Unit at Lloyds Road. We have a Clinical Trials Unit in Gopalapuram and a Food and Nutrition Research. We collaborate with various national and international universities. We are recognized by the ICMR, DST and DBT, and recognized by the Madras University, NGR Medical University, and now Deakin University, Melbourne, for doing PhD courses, which means that somebody can work here in Chennai and get a PhD from Melbourne. We have over 1,100 publications, which is a kind of a world record from a single institution, over 710 original articles, 240 editorials and 150 chapters in textbook. And again, this is all because of the extensive teamwork and the number of people who are involved in research. Over 100 people are involved in full-time research at our center. We have collaborations, and this is only a partial list, with the University of Alabama, University of California, San Diego, University of Minnesota, Emory, Howard School of Public Health, all these in the United States, with McMaster University at Hamilton, with the Deakin University in Melbourne, University of Leicester, Warwick and Dundee in UK, Cardiff, and many other institutions. And of course, several national institutes, including the All India Institute of Medical Sciences, with whom we collaborate very heavily. In 2008, we had the honor of being designated as a World Health Organization Collaborating Center, as a WHO Collaborating Center for Non-Communicable Diseases Prevention and Control. Many years ago, the ICMR selected us as an Advanced Center for Genomics Research. And in 2016, they upgraded us further to say that we are now been made an ICMR Center for Advanced Research on the whole of diabetes, and we are the only advanced research center in the country. And
Sir, can you close on?
Threat to all of our societies, that for our children and for future generations, that we must develop new paradigms to identify the risk factors for diabetes, to have interventions that are broadly implemented throughout our society, and then for those individuals who develop diabetes to make sure that they receive the aggressive, appropriate care to prevent the complications of diabetes. So it's not only a medical, it's not only our professional, but it's our duty as citizens of the world to reduce the impact of diabetes in this generation and in generations to come. And so it's a great pleasure and honor to be part of those efforts. And the American Diabetes Association looks forward to working with a number of entities like the IDF, the World Health Organization, the Indian Societies around diabetes, and centers like Dr. Mohan's to make an impact on the world by reducing the impact of diabetes. So thanks again for having me.
Diabetes tsunami, war against the diabetes. All these words are correct, but I don't know what is a single word to describe the current status of diabetes in the whole world. Every 2 seconds, somebody out the world is diagnosed with diabetes. Maybe someone in this room. Every 6 seconds, one person dies from diabetes. What kind of disease in human history has a significant impact in our health and our mortality, such as diabetes? What about the economic impact? If we properly manage diabetes, it could easily bankrupt your own country. One time I was playing golf with the Minister of Health, he's a good friend of mine in Korea. I asked him why diabetes is not included in 4 major diseases. He said, "Now you know the answer." I said, "No, I don't know the answer." He said, "Money." We are intentionally avoiding to see the fact. That's what it says. 415 million people living with diabetes in our world. 192 million people yet to be diagnosed with diabetes. About the same amount, high risk for diabetes. If you add all these figures, 1.2 billion people at risk for having diabetes. You know, it is such a good feeling to see the champions like Mohan's institution. Dr. Power, and I should turn it over all this, our leadership to him to battle diabetes. Now, nobody, no private institution doing such a good job that IDF and ADA plan to do in the future. So I really congratulate you, not just you, but your whole family who dedicated to fight against the diabetes. Congratulations, and we look forward to see more successful meetings in Chennai. Thank you very much.
The first global report on diabetes, highlighting and bringing global focus and attention to this significant health issue. The 422 million approximated, and I'm sure that number has got its limitations, and others will have estimates also. Staggering numbers, 450 million people with diabetes. but as mentioned, the significant number of people who are undiagnosed. The cost, estimated 830 billion, and it's only the direct healthcare costs. So as already emphasised, there is a real impact on individual health, family health, communities, our health system and our health budgets. I'm challenged by our speakers' comments. What do we call this situation? What is the single word that captures all of that information? We've heard from Dr. Chan, our previous Director General, call the non-communicable disease agenda a slow-moving catastrophe. This was some years ago. You don't see it. You don't see it in quite the same way as you see some of the communicable diseases that threaten health in Africa and parts of Asia too, of course. Non-communicable diseases has been neglected. We have failed to communicate, to convey, to convince and to engage the global community on addressing this. But here in India, I'm inspired by the work that is clearly going on the ground here. Because there is hope and there is positive work here. The fascinating science that we've heard this morning and we'll hear for the rest of the meeting is being translated into the work that you do in clinics, the work that we do. And I hope to share with you tomorrow the work that we need to do at the population level to reach all people and to create the environment and the community where diabetes is something perhaps we will look back on in a very different light, with the promise of good management that we've heard, but in fact the numbers far less. And of course, to get to that place, we must look at the leading risk factors for diabetes. The overweight and obesity and the physical inactivity being two in particular that we can address, we must address.